Okay, right. Well, we're here again, Elaine. This is our second of the webinar series. And today we are talking about transformative training in health and social care and competency. Now, if you're live with us, thank you very much for attending. It's much appreciated giving up your time. And I want to make sure that you get the most out of this in giving that time up. So we're going to be exploring and looking at different elements today. And what I really want us to have is an open mind to things. I don't want us to get stuck in regulatory, what we believe requirements are, and actually really start to look at it from more of a maverick or a disruptive viewpoint. Well, hold on a minute, there's got to be more than one way of doing this because the normal cycle is just on repeat, and we're not really moving much forward. So that's really what I want to get in the essence of this today. If you are watching this afterwards via the recording, then again, thank you very much. I know a lot of people have reached out to us and said they can't make today, and they can't wait to see the recording. So for you, stick with us. And again, we hope you get a lot out of this. What we would want is at any point you have a question, just to pop it into the chat box. And one of us will pick it up and get you the answer to that. And if you're watching it on recording, then please feel free to reach out to either myself, Paul, or Elaine, who you can see on the screen also, at any time, and we will get you that information as well. Emails will appear at the end of this recording. I think it's at the end of the recording, and so reach out to either of us. But today's topic is how we actually transform training in health and social care, and we start to embrace and include competency into it. So just as I move the slide on, and a quick introduction, if you don't know who I am, my name is Paul Blane, and I'm the founder and CEO of many different organizations within health and social care, both in the educational market or in the provider of care market. So you can see a little bit of my background there. I'm very much predominantly background of care home and community care, particularly with the elderly. And I'll let Elaine introduce herself in a moment because she does the other end of that spectrum. In terms of from Care Business Associate training, we're a national training provider. We provide to over 9,000 sites across the UK. And that's in a whole plethora of topics ranging from all your clinical needs to all your mandatory, statutory, and management skills. And we'll go more into that as this goes on. I've appeared on many stages, and I often speak the same thing continuously, and that is very much around my basis that if you know the alphabet, why the heck do we have to go back into a classroom each year to actually relearn the alphabet? And that's the mantra that I will take into this today as well. If you were someone that used to follow the Health and Social Care Club, that was something that I founded way back in COVID. And helping a lot of people with information during those COVID times. And that was brilliant because it was an award-winning club that we created. And I'm also the founder of Confident Competence, which we will go through today. So that's a bit about me. I'm older now than once I was when I first started. So there's a lot of wisdom and experience there that I'll try and get across today. I want to introduce my co-host to this, who is Elaine, and I'll let her explain who she is.
Morning, everybody. My name is Elaine Warner. I'm the MD for Care Business Associate Training. And like Paul alluded to, my background is more children and young people. So I've probably worked in 30 years plus in kind of children, young people, children's homes, education settings. I've also done a lot of work with kind of adults with mental health problems, learning disabilities, but predominantly kind of and the children's side, if you will. I've run my own business for many years before I came and worked with Paul. And, I know it's very difficult as an organisation to factor in the training needs of your team. And so here we are today to, look at it from a kind of a different glance, like Paul was saying, transforming, disrupting. That's what we're all about. So thank you for joining us.
Brilliant. So, Elaine, I'm going to keep bringing you in as we go on, particularly from a training needs analysis background. But the first thing I really wanted to point home today was how much money gets actually spent on upskilling the workforce and giving them the tools they need to be able to perform at a very high level. So, I always look at it from a starting point of 5 things we need to know about our teams. Well, your reputation is dependent on the care that people receive. So, I'm someone who's visited thousands now of care homes and different services across the spectrum of health and social care on a very regular basis. And what I would actually always turn around and say is the chandeliers hanging from the ceiling and the Laura Ashley curtains are all well and good, and they're very beautiful, and it's like walking into a hotel in Dubai sometimes. However, that's not what people are interested in who go into care. They're interested in the care that is delivered to them. So to me, I've always said that the biggest asset that you have within care is the care team, the people that are supporting people and all the auxiliary staff around that to help the well-being and mental health of people who reside there. So in terms of investment, that has always got to be your biggest level of investment because that's what people are judging you on. So your reputation is always dependent on the care that people receive. 55 to 6% of your turnover is providing people to deliver that care. So what I mean by that is in most businesses, when you look at your actual turnover, your expenditure cost on staffing to deliver that service is roughly around about 55 to 60%. So it's the highest proportion of your expenditure in order to deliver that service that you're doing. And that is absolutely true, whether it is in care homes, domiciliary care homes, or anywhere else where we're delivering care, because care is a people person industry. It takes people to deliver that care. So when you actually look at it in any business, if that was your highest level of turnover, then your next question has got to be, are we getting the best performance from that? 2 to 5% of your turnover is spent on skilling those people. I nearly said killing those people. Don't do that, right? Skilling those people. So 2 to 5% of your turnover is spent on that. So this gets very interesting when we're actually looking at this from a financial perspective, because if 2 to 5% of your turnover is spent on skilling those people, then how are we actually retaining those people? Because that's quite a lot of expenditure. But if we look on average, 30% of the team will leave over a 12-month period. So that's average. If you're nowhere near that level, then you're way above average. But if we look at industry averages, it's roughly around about 30% of people will leave in 12 months. So what do I mean by that? Think about right now, today, all of your team. And what we're saying is statistically, 12 months from now, 30% of the people that are there today will not be there this time next year. Now, it ranges up and down depending on how good your retention is. But if 30% of those people are going to leave, then that 2 to 5% that you've spent in upskilling those people becomes quite a costly amount. And that's why we have a diverse range between 2% to 5%. Because if it was 2%, that means we've retained all our staff. But if it's 5%, it means we've got really bad turnover of staff. So we're having to spend more and more money. Here's what's really interesting when we look at stats, Elaine. 80% of that 30% will be new starters that year. Now, that's where a lot of your big spend goes, into new starters, because you're inducting them in and you're supplying them with a lot of training and skill and mentorship and time and energy. But 80% will leave within that first year of the 30%. Okay, not 8% of your team, 8% of the 30%. Now, we have to ask ourselves the question, why is that? Now, I've spent so much time in management training, had so many consultations with managers, worked on strategies for care services to actually address this fact. And the reality of the situation is what I normally get is defense barriers that go up. And that defense barrier is, oh, well, we just interviewed the wrong person. They had the wrong idea about the job. It was the money that they were on. It was the fact that they didn't want to work weekends. There's so many reasons that get churned at you. Now, I'm not dismissing all of those reasons. They will play a part. But the main reason that people actually leave within the first 12 months, and particularly within the first 3 months, is confidence. and competence. It's the ability to know whether they can do the job or not. And you're spending a lot of money on this. So we need to tackle those last 2 points by making the most of a 2 to 5% training budget. So when I talk about this openly, how do we actually tackle that? Because if we're going to spend the money and give them the skills to actually do the job, then how are we utilizing that money to give them the confidence and the competence to be able to do that job? So when we actually look at it, I like to look at this, and I know a lot of people may dispute it, but you know what? When you actually really look down into it, it's not too far from the truth. And that's something called the cone of learning. You can go and research this and look it up yourselves, but this is basically what it's saying. It's looking at the psychology of people and how we learn. And you can see that after 2 weeks, we tend to remember certain elements. Now, if we look at sort of like the top one reading, 10% of what we read, we remember. I want you to really think around the fact of when you read a book, and you may think that that is a great book, you loved it at the time. But if I sat down with you and said, okay, explain the book to me chapter by chapter, what went on, what happened to the lead character, etc., like that, you would give me roughly around about 10% of that book. Because 90% of it was good at the time, but it's gone. Now, how would I relate this to learning that we have within health and social care? And I'm not here to dismiss any type of learning. All learning has a place and is good. But when we're looking at reading and we're looking at 10% of what we read is what we retain, sorry, we only retain 10% of what we read. Elaine, I would say that that's e-learning.
Absolutely.
Now, when I look at the majority of training we do in this industry nowadays, it's e-learning. So we're wondering why our staff aren't developing from the training or are not using the skills they've learned from the training and putting it into practice on the floor. It's because they're starting work with you and they've been given a shed load of e-learning courses to do. There was one company that I was consulting with, a large company, I won't name them, but a large company, who were doing 32 e-learning courses a year. Now think about that. You just started work there and you're doing 32 e-learning courses within the first 12 weeks from fresh. And you're only going to retain 10% of that. So how could you possibly be confident in the role that you are doing? Because you're missing 90% of the knowledge that you need in order to do the role. We see hearing words, 20% of that. Well, I would actually put that down to your coaching and mentoring. So that's bodying and actually working with someone who's skilled and experienced on the floor, who's going to help and nurture you and answer any questions you've got. Or like a child, when you're listening to your parents and you can't talk yet, you're going to mimic what they're saying. Often the wrong word that you said, but they're going to mimic those sort of things. And that's the coaching and mentoring. And the same with the seeing, 30% of what we see. Now, here's the biggest problem that I find in the industry when I look at this, Elaine. And that is, if I'm seeing the wrong things, that's how I'm actually going to work, because that's much more likely to stick with me than an e-learning course where I get 10% remembering from it. And it goes down. Now, I want to take us right to the bottom one, the 90% of what we say and do. Doing a dramatic presentation, simulating the real experience, doing the real thing. That's working. And that's why always our learning will come from the floor. Now, I've been an educator for over 30 years. Now, when I first started in care, and Elaine, I don't know whether you're of similar thought process, there wasn't much training when I was around when I first started. So I started as a care worker at the tender age. I think I just turned 17 and a half or something like that. So a very, very early adopter. That shows you how old I am, because I wouldn't be able to do that nowadays. So this is way before even the from the Health and Social Care Act to the Care Act. So I'm sort of like way before that. The National Minimum Care Standards. Some of you are probably not old enough to remember that, but I way precede that. So how did I learn what I learned? And in those days, you learned from the people that you worked with. It was almost that method of get thrown in at the deep end and see if you sink or swim. Now, I'm not saying that was the best way, because I made a heck of a lot of mistakes early on in my career. And when I make mistakes in my career as a care worker, the problem that you've got is the people on the receiving end of that are some of the most vulnerable people we have in society. So that's not a good thing. But ultimately, I would still say to this day, most of the things that I learned happened by learning from other people that I worked with, or listening to other people, district nurses and the likes of that, when they came in, and showing attention. So when we look at what we remember, and we're starting to look at this from a training perspective, how many different types of training can we put into the hat to help develop and upskill our team? What I would say is, if you are completely e-learning, that's why you don't have the skill set within the team to be able to carry out the role. If you have no coaching and mentoring going on and nurturing, you're losing out on a 20% remembrance. But also, how do we actually create those practical skills? How do we develop them? How are they being learned? Because that's the biggest learning tool that we actually have. And that's almost sort of like saying moving away from academic study and moving more into practical based learning, which is what health and social care really is. So it's just interesting when we actually start to look at what active learning is and what passive learning is when we look at the cone of learning. So how do we factor all this in when we're looking at training needs analysis or training budgets? Well, the first thing we need to do is to set a training alongside what a vision and mission is for the company. And there's a few little tips that I will give you in relation to this. You see, I would personally, this may be a bit dangerous, but I would personally guarantee you that if I came and spoke to your workforce, and I'm talking about lower level than management, and I asked them to tell me what the vision and the mission was of the company, and what the business plan was, and what the goals are for the next 12 months, and what it is that you're trying to achieve, I think I would get an absolute plethora of different answers. And that's a problem, because it's not consistent. And therefore, we've got sheep in a field with gates open, and the sheep are just running all over the place. Sorry if I've just called your team sheep. I don't mean that. It's just a way to phrase it. When actually, we've got one gate that we want to drive towards because the grass is so much nicer in that field over there. So we need to herd in one direction. Everybody needs to understand. And for that, we're going to need some shepherds, and we might need some sheepdog, and etc. like that. And that's the hierarchy of our team to drive from there. But the most important thing is to sit there and go, actually, as a business, what is it that we are trying to achieve over the next 12 months? And how are we going to utilize that 2 to 5% of turnover that we are spending on training to get us to that promised land? And that's a key when it comes to setting out a business strategy. Now, you may think, oh, well, hold on a minute, we've got to do all these mandatory and statutory courses. Yes, because we've got stock in them. And that's the big bit that I'm going to come to. You see, for the new starter, it's important that we communicate effectively what it is that we're trying to achieve and how they can help us to do that. For our existing staff, once we've communicated that, we shouldn't need to send them back to the classroom or back to the e-learning course to learn stuff they already know. We're sat there thinking that they already know this, but we have to do it because we need the flaming certificate to show our compliance to the regulator so that we don't get downgraded. Yet the regulator is screaming out to you, competency assess them. Make sure they do know. It's on you. If you've provided the training and you've given them the skills, then prove to us that they have the knowledge, the experience, and the qualification in order to carry out the role that you expect of them. So we should not be having this method of madness that we have where everybody does the same thing. Let me just give you an example of that. I mentioned earlier that I've got 30 years experience of working in care from every aspect, from a support worker to a deputy manager to a registered manager to the owner of care home businesses, to being an educator, to being a lead national trainer. I've worked on so many commissioning boards. I've worked with government in terms of policy making and writing and think tanks, so many different things. Now, let's say I come to work for you because I've decided I want to go back and I want to actually spend my last few years back where I started as a support worker. And along comes Joe. who's never worked in care a day in his life. Here's the mad thing, Elaine. We're both going to be given the exact same training. Name another industry where that would happen. You're going to take me back from probably being a level 9, 10 person to level 2 learning. Because we're so set in stone of the pathway we're going down. So you're not going to get the best from me. Joe needs it. At this moment in time, what do I need? Competency assessing. Can you do it? Prove it to us. Once you've done it, let's crack on and let's get the most out of you. So when we're looking at training budgets and how we build them and set them out and associating that to the vision and the mission of the company and incorporating some of those mandatory and statutory requirements that we have within it, we're not going to do one type of training to suit all, because that doesn't work. We're going to utilize our budget so that we have clear pathways for everybody. And when we start to look at this, we'll find we actually drop that 2% down even further. We'll start to reduce our costs. You see, I talked before about this large company that I work with, and this is a hidden cost that no one sees, Elaine. When we looked at how many e-learning courses they were doing, they paid a contract price with an e-learning provider. They got the LMS, fantastic, they get it all. But ultimately, the cost of that contract may be £16,000 per year. Right? That to them, for the size of their turnover, it's not that much. So they're never going to stop it. And from that moment, there's this mental thought process that says, well, it's only costing us 16 grand a year. But then actually, when I turned around and said, well, how much are you paying staff to do an e-learning course? And they turned around and told me the figure. Do you know how much the hidden cost was? £160,000 a year. But here's the mad thing. No one had noticed it because it sits in the payroll. It's hidden. But the minute you took it out the payroll and you started to look at the 32 courses, and we really started to look at it, actually, I got the 32 down to about 12. The saving was round about £70,000 immediately. And by the way, that's the greatest £70,000 saving ever, because those staff didn't want to do those e-learning courses and were forever getting hounded by management and HR to get their compliance up to speed and up to date. Why didn't they want to do it? Because they're not learning anything from it. And your brain will only ever kick in when there's something new to learn, when it's something I need, when it's something I can do something with. If it's something I already know, oh, imagine turning up tomorrow morning, Elaine, and I say to you, I've booked you onto a course where you are learning the alphabet from scratch, and you're going to spend 3 hours doing it. You will have lost the will to live at that moment in time. You'll just become a pain in the backside, because you'll sit there and go, can I not just tell you the letters of the alphabet straight away and walk out of here? And we see it all the time. So it is madness. So unless there is something new to learn, and this pains me to say this because we're a national training business, I'm sure Elaine will have a word with me after this. Unless there is something new to learn, avoid the classroom. You know, the job is to prove the team is confident and competent, i.e. skilled to do the role. So how are we going to do that? Well, what we can do very quickly, Elaine, you must remember this back in the days of university, the conscious competence model. Do you want to know the one thing I loved about this model was the fact that actually I got to legally turn around and say that someone was an unconscious incompetence. And they'd say, you called me what? No, it's a theoretical model. Right, so what do we mean by this? And this is me leading you in to how we're going to determine if someone is confident and competent to do the job. So we've got the unconscious competent. So that's someone that's not aware of the skill yet. So they don't even know about it. Think about it. When you were born, did you know you had to brush your teeth? Absolutely not. So it's not actually saying anything. I could say that you, everybody listening to this, is an unconscious incompetent in a lot of things in life. Yeah, things that you're not even aware you don't know how to do. The problem is at that level, that's absolutely fine. Now, I would say a new starter starting in care is right there, bang right there. They don't have a clue what it is they're supposed to do. They may have read the job description, etc., like that. You may have interviewed them really well. They may have spoken to some friends, But day one, when they come on the floor, they do not have a clue what it is that they're supposed to do. You're turning around and talking about care plans. They've never heard that word. You're talking about person-centered care. They've never heard that word. Yeah, let alone when you're looking at continence, let alone when you're talking about specific things like dementia or mental health. They don't know. They're unaware that they need that skill at that moment in time. And that's why sometimes when they find out, they run because they're not competent. And they're worried that they're going to either hurt themselves or they're going to, worse, hurt someone else. So we have to be fully aware of that. And that's where I go back to. You can't just land this person with e-learning courses and expect them to turn out to be a fully qualified professional support worker at the end of it. Now, when we move to what we class as a conscious incompetent, what we're talking about here is they're aware of what it is they need to do, but they lack the skill. So this would be coming back in on day 2. So now I'm aware what it is that's expected of me. I just don't know how to do it. And they're going to be making decisions all the way through this process, which is why those first 3 months, when I mentioned 80% of the 30% will leave, they're stuck here. They're aware, but they lack the skill. Are you giving them the skills they need to move on? And when we look at moving on, we're talking now about someone who is becoming a conscious competent. So they're not fully competent yet. They consciously know they're working on it. So they've now got to a point where you are saying, right, we're going to help you. We're going to assist you. We're going to have meetings. We're going to talk. We're going to do different types of training with you. We're going to have lots of supervisions with you through this process. We're going to have a proper induction. You are going to buddy up with someone. Right? They are now actively working towards a skill, but it requires them to think a lot about it, which is why when someone goes on a moving and handling course that's brand new and they're shown how to use the hoist in the classroom, it doesn't mean they know how to use the hoist. It really doesn't. They are aware of that skill and they've had a go at it. But please do not expect them to be able to go onto the floor tomorrow morning and be able to use the hoist. They're actively working towards that skill. And it's only at the competent, when we can turn around and say that someone is competent, that they are so skilled that you no longer even have to think about it. They can just do it. Some of you will be like that with driving. Think about when you first passed your driving test. I would say you were still a conscious competent at that point. You were still doing the 10 to 2 on the steering wheel. You were still checking your mirrors every time. You probably got in the car, seatbelt on, fix the mirror. Right, okay, start the engine. Okay, am I in reverse? You probably did the whole thing. Think about now. You've been driving for however long. But you just get in your car and drive. And that means that you're competent. Now, when we get someone at a level of competent, unless it's a brand new skill, we should not be going back around this loop. We should be still checking the competent. How many staff do you have in your team that have done the same training courses year after year after year, not going up in levels? You are just sending them all the way back, but they are aware of the skill that they lack and they have been actively working to it and they know that they can do it. But yet we're starting them right from the beginning again on the same thing. So that's where I start to look at things like conscious competence models. Now, don't get me wrong. Competence is not training. Okay, education is always paramount. However, we are going to teach people has to be at the start and premise. However, once they've got the skill, once they know it, and once they're competent, it is competence that we should be actually doing. And you are doing competence assessments to actually ensure that one, they still have that skill, or two, if there is a gap in knowledge or a gap in practical skill, we can reintroduce the training. So competence sits at the top of the pyramid, and that includes knowledge, attitudes, and behaviors. That's so important, yeah? Because what we don't want to do is get so confident that we become complacent with it. And that's where attitudes and behaviors come into it. But training is always the starting premise. If I want to learn how to play the guitar, I don't just pick up a guitar and start playing it. I would have to go back to training in that. And it's only when all of a sudden I'm an amazing guitar player can I turn around and say I'm competent in that. So why on earth then are the regulators really now concentrating down on what we call competence? Well, see, the thing is, what they've noticed is that most companies now have an LMS, sparkling, shining LMS with a beautiful reporting system. And when they ask to see your training matrix, you're showing them and saying, we're 95% compliant in this, we're 100% compliant in this, because most of it is done via e-learning. So it's very easy to just issue an e-learning course, member of staff does it, and goes into a reporting system, and you're able to give it to the regulator on request, or the inspector, or whoever it may be. And what they're saying is, for the first time in a long time, near enough every company in the world of health and social care is doing the most training they've ever done, in the most subjects they've ever done, and is the most compliant they've ever been. It's amazing. Big cheer. However, why are safeguardings not dropping? Why are falls not dropping? Why are meds errors not dropping? There's so many different levels that they look at now and go, so they're doing the training, but how on earth do we know the training is working? And the answer is, when you look at it statistically, it can't be, because nationally, those stats would fall through the floor if it was working. You see, if you educate people in the wrong way, it doesn't change who they are. It doesn't change their skill set. And that's the bit where now they've looked at it, and under the single assessment framework that they brought out, they put competence right in the heart of it, which is why now, if you get inspected, they don't just want to see your training matrix, they want to see your competency assessments in all these different subjects to prove that you have evidence to show that those people know what they're doing and your investment in their skill was the right investment. And that's why we start to see in the single assessment framework, not just in England, but in Scotland, Wales, and Northern Ireland, you can see that they're tied in regulations such as, or standards such as 17, 18, and 19, which is all about governance, which is all about taking a systematic approach, and it's all about systems to assess competence. Scotland has gone even further. They literally have put competence right at the heart and want it spoken about and seen broadly. Wales, with the Care Inspectorate, are now focusing on inspections around that, and Northern Ireland is actually developing its own competency framework. So you know the regulator's on top of this, and if you've had an inspection recently, I'd love to hear from you, to hear how much did they ask you about competency related to that. If you've not had one, I've been involved in about 30 in the last year, and I know that 90% of the time they're asking for it. It's catching people out. So you could ask yourself, well, what is a bloody competency assessment and how do we do it? And just to back that up, one of the biggest things that they've done was they introduced Regulation 12 into it. Now look at what Regulation 12 says. Make sure that staff have qualifications, competence, skills, and experience to keep people safe. Here's why it's so important. Of the 34 written statements that you will be judged on, scored 1 to 4, that inadequate to outstanding, 61% of them have Regulation 12 tied to the scoring. That means 61% of those quality statements, they need to see evidence of competency assessments. And that's where we're going to change it up. Now, we know this is true, Elaine, because Skills for Care and Skills for Health recently relaunched the criteria for training for mandatory, for statutory and mandatory and statutory subjects, particularly mandatory, because statutory is basically around your needs of a service. Mandatory is legal. And they changed it. Moving and handling used to be every 12 months. It's now every 3 years. In fact, most of the courses got pushed out to 3 years. So here's just a little tie for you. If you are actually doing e-learning every single year on certain subjects, have a look at the Skills for Care document that got released. I can definitely send it to you if you want to reach out to me, and get it changed on your e-learning system, because most of these courses can now move to 3 years. But there's a caveat. You must be competency assessing the skills on an annual basis. That's the caveat. So that's where they want to see the training certificate and the competency that backs up year 2, year 3. Now, please, as I said, do not mistake training and competency. If you think to yourself, well, it's okay, because I'll just keep them on the training course every year and that can act as a competency, they're not accepting it. Competency is observational practice of someone on the floor. That's what a competency is. It is not a knowledge-based assessment. I'm sorry if you think, well, I'll just get them to redo the questions that they got from the e-learning course. That's not a competency. That's a knowledge check. What we're after in a competency is a practical check. So let me drag you back, and I'm going to shut up in a minute and I'm going to let Elaine take over. But I just want to sort of like mention about preparing your strategic training plan, because what I want people to walk away from here and think is, okay, if we're going to do a strategic training plan for the next 12 months or the next 3 years, what does that look like? Where do we start? Now, you may think you don't have the time, but if I was telling you now there is lots of money to be saved here, that should focus your attention on, we need to make the time. You can obviously reach out to Elaine, who I'll bring in a second, as I said, who will talk to you about the consultancy services we do, the training needs analysis that we do. And by the way, for most cases, that's free of charge. Now, what I will say to you is there's a caveat to that. Of course, she's doing it free of charge because she wants your training business. That's what it is, right? So I'm not going to sit here and say, oh, no, there's no con here. It's not a con, but we're happy to come in and look at all the different factors that can go into saving you money and getting the right strategic training plan. Now, I mentioned about an e-learning provider. I would never in a million years get rid of an e-learning provider. You need it to a degree. And I'll tell you why the main reason you need it. The LMS system, the reporting system is amazing, what they've built. So you need to be able to capture all your information. And there's certain courses that lend themselves very well to e-learning. Absolutely there is. You also need a key partner, a face-to-face training provider. Now, Elaine, I'll just fetch you in that, because when I say a key partner, face-to-face provider, what is that screaming to you? What would you advise people to look for in a training partner?
To ask the right questions, I think. So such as, is that training provider going to come in and do an analysis, do a training needs assessment, where they can look at what e-learning that people are doing, what face-to-face they're doing. We can obviously match it up with skills for care, skills for health, because if people are doing too much of training, then that provider should be saying to you, why are you doing the same course every year? You only need to do it every 3 years. What you'll be doing in between is competency assessing, save your money. And I think it's very much about whatever, we'd like to be your training provider, but if we're not your training provider, make sure you ask those questions for them to be guiding you, because that's their area of specialism, or it should be. They should be able to, like we were doing with that company the other week, it was 34 e-learning courses that they were actually paying them to do off the shop floor. So think of the costs with that. And a lot of that, it was duplication. And, we have good oversight of e-learning courses, and we help write e-learning courses for some platforms. And, there's a lot of duplication. So we can be saying, why are you doing those 4? Because it's covered in that one. And quite often, because it's mentioned a key word, then, care providers just thinking, oh, well, we'll just stick them on that course because then that will tick a box and they'll have covered it. Whereas we could actually be saying, you don't need to be doing 4 e-learning courses because all of that is mentioned in this one. So you're cutting down your e-learning, and that training provider should be guiding you with that. Then looking at what face-to-face training you have. It might be looking at, national insurance contribution from employers, and, the heat that the care provision is facing at the moment, that actually, it might be that there's a train the trainer that we can be incorporating. If we've kind of got larger or smaller organisations that actually might benefit by training their staff to be able to deliver key subjects. If you think, for example, basic life support, generally people put people on a basic life support course annually because they think they have to put them on annually. But when you look at all of the guidance, it states they need to be competency assessed annually. So if they had an internal training team and got hold of a mannequin, that they could then be competency assessing their staff, watching them do CPR on a mannequin and talking them through how they put them in the recovery position, how they would then deal with a choking casualty. You've then saved your staff frustration of going on the same course year in, year out, because that's where we get disengagement, because your staff already know it. Like you said right at the very beginning, that if they're going back into the classroom and they're just relearning everything they've learned, then that's where training gets a bad name. And you like, I'm very passionate about safeguarding training, annual, but it doesn't have to be the same safeguarding training annually. And that's what care providers don't understand. Whereas the training provider should be saying, yes, it states some form of safeguarding. You could have a focus on cuckooing, you could have a focus on gaslighting, different elements with that. It doesn't say you have to put your staff on mandatory safeguarding training year in and year out. So it's about, like you're saying, transforming. It's sitting down and spending a good couple of hours looking at all of the elements of where they're spending the training budget, where the pain points are, where they want assistance with, where we can give them guidance on, and working absolutely in partnership with them, as opposed to saying, yeah, here's your training, thank you very much, we'll take your money, we'll see you same time next year. Should be a collaboration.
That's a big point to this, and it's something I always valued. And I think it comes from my being a care provider background as well, is that for most people, they will identify the training they need because someone's told them they have to do it. They will ring up a training provider and they'll say, do you deliver this training? And the training provider will say, yes, no problem. And they'll come out, they'll deliver it to the classroom, and they may be delivered brilliantly, and they'll issue the certificates and off they go. But actually, the bit that's missing here is that if I was sort of like making that phone call to Elaine, it's a bit like if I phoned up my accountant. I'd be looking at my accountant and going, you are the expert. You're the person that knows whether I'm legal or I'm not. You're the person that can tell me if there's any loops in the system that can be utilized or where money should be invested. That's your job because you live and breathe it and you are the expert. I know about finance. I run a business, but I'm not the expert in that area. So I need you to keep me safe. I need you to actually advise me. And I think that's the bit from a training provider. When I sort of say a key partner, it is that you are contacting what should be the experts who can turn around and say to you, no, this is what the regulator requires. This is the best way to train your team. This is the most cost-effective way to do it. This is the bite-sized learning that they will need to be introduced to over segments of time. This is how you should be carrying out supervisions. This is how you tie it all in. This is how your values actually seep through, because they are the expert. And you should utilize that expert. There's many things in life where I am not the expert, and I know about it, but I am not the expert because I don't live and breathe it. So I need to look for the expert. And in a training provider, you need the expert, somebody that's going to.
I think there's also on that is working in tandem with e-learning, such as masterclasses, where they might have done the theoretical stuff on the e-learning, and so then the training provider just going in and doing that practical assessment. Another client I'm working with, they do 3 separate e-learning on moving and handling. 3 separate ones, and I bet if I sat down and did all 3 ones, there'd be loads of duplication in it, and it's making staff kind of sit down and do that, and then they switch off. Absolutely switch off. So it's about kind of saying, what's in your e-learning provision? Right, this is where we will fill the gaps. So you're then getting your staff trained. They, do a like kind of theory assessment at the beginning, have a bit of a, assessment quiz type thing. And then it's saying, right, this is where the gaps are. Then we'll come in and teach that. So it really is about utilizing the knowledge of the training provider, who should be saying, why are you doing it that way? They should be challenging you. Yeah. Why are you doing it that way? And actually, we have a better way. We have a different way that is equally compliant with regulatory bodies.
Brilliant. Now, this moves me on to the next part on this cycle when we look at body and mentorship schemes. Okay. Now, I know they've been around for a long time, but it's so important actually you understand the importance of this, because I'm going to take you back right to the beginning of this when I said of your 30% turnover of staff. And again, before anybody shouts at me, you may not be at that level, but statistically, 80% of them will be new starters in that year. So looking at that, we now have an understanding that in the main, it is down to confidence and competence and their ability to do the role. Yeah, so just for 1 minute, just take away all the other issues that you put up there to defend yourself as to why it didn't work. When we're looking at body and mentorship schemes, it's important that they are placed in there for the brand new starter. Now, one of the mistakes that I see within businesses in this is they will look at putting someone at a higher level than the person that's coming in, so a different job role, to body and mentor that. And to me, that's a wrong skill. For instance, if Elaine was a manager of the home, and decided she was going to body and mentor the brand new staff member that came in, Elaine may think that's amazing. I'm giving up my time to body and mentor this person. But it's unlikely that that person is going to ask Elaine stupid questions, because they don't want to actually see themselves as stupid or be perceived to be stupid. If it's someone who has been them, and sometimes recently, and someone who can nurture them, someone who has the same job level that they're taking on, they're more likely to open up. They're more likely to ask, how do you do this? When do you get paid? Oh my goodness, I'm a bit scared around this. So the other person say, don't worry, I was the same, right? But you will learn this. The person that might go for coffee with them on the coffee break and make sure they're okay, make sure they're settling in okay. And that's normally what we class as a peer. Now, a peer is someone at your level. Okay, if you give me someone at a senior leadership level, I'm less likely to open up on some of those questions. I'm less likely to tell them something's wrong, and I'm more likely to leave rather than do that. Whereas I'm more likely to explain it to someone who I don't feel intimidated by if they're at my level. So we can help by giving, and this is where we talk about save the money. It doesn't mean you get to run off to Barbados with it. We just start to spend it more wisely, because we're going to try and use training to tackle problems and create pathways. So when you actually start to adopt body and mentorship schemes, give the opportunity to give a new skill to someone within the service. And that can be someone that's been there for less than a year. Remember, if they've been there for less than a year, our job is to keep them there past a year. So ultimately, if we now give them a newer skill set to go on, likelihood is they're seeing progression in their career within 1 year. That's going to keep them past that 12 months. And if they get past that 12 months, they're much more likely to stay a lot longer. So that's another area that I've worked with a lot of companies and helped hugely in the retention. In fact, some of the case studies are unbelievable that we've done when we've introduced these schemes correctly. The next one, effective competency assessors. So anybody who is skilled and knowledgeable and able to do the role within your service, and that can be for a specific area such as IPC or moving and handling, or as Elaine alluded to, safeguarding, they can be given the skill set to competency assess people. It doesn't have to be a manager. What makes an expert? What makes someone, of a high level? Competency is having the skill to do it and knowing what it looks like when someone else does it. So there's so many different avenues you can go down by introducing competency assessors. But once you've introduced competency assessors, you can start to reduce down your face-to-face training needs. You can start to reduce down your e-learning needs, and you can have the evidence that backs up and supports that the regulators need to show that you have a working team working with the right skills, the right practice, and developing at the right speed. And by doing all that, it brings us around to the next level, which is spend effectively in critical training. Now, when we talk about this, is where it ties in to the business plan. You see, if you are looking for the private market has a lot of choice on their hands. And when they have a lot of choice, there's certain elements they're going to look at. And one will be customer service. I'm on about when they make the phone call and the other person's picking it up. I'm on about how we're now asking teams to be sales and marketing. We're asking teams to, like I said, customer service, deal with complaints, deal with challenges, be solution providers, be innovative. Well, they need training to help them to make that become a reality and mature with it. We can look at management training very much around profit and loss accounts, being effective with budgets and spending, contract negotiation, procurement. All of these are skill sets that most managers don't have, because managers, they came up through the system. They were just really good at what they'd done. Proper leadership skills, looking at communication effectively, writing business plans, goals and ambitions, and being able to communicate that out to the team. That is where we can start to spend the money that's going to drive the growth of the business, which is critical when it comes to that development. So when we're preparing your strategic plan, they're the sort of things that we look at. So just a quick synopsis on what I've just said. If we're looking at an e-learning provider, it should be a system that's easy to use and simplistic to view. I see too many. I'm sorry, I'm going to get shot down by friends of mine who are e-learning providers. Sometimes we overcomplicate the bloody hell out of it. What do we actually want it for? And that's to deliver our training and be able to get a report that tells us how compliant we are. In effect, in the main, that's it. If we think staff are going to use it as an internal messaging board and everything like that, likelihood is they've got WhatsApp for that. I've just had something flick up on my screen that says 5 minutes left in your meeting. I hope it's not going to cut us all off.
No, it won't. Don't worry.
Okay, good stuff. By the way, for everybody listening, it's not going to take much longer than that. It allows you to pre-plan 12 months. It can add all your training records, supervisions, and appraisals, and it's low cost. It should be less than 30% of your training budget. So if I was a £1 million turnover company with a projected training budget of £20,000, then my LMS and e-learning spend should be around about £6,000. And we work with many e-learning providers. One in particular who I think is absolutely fantastic is the eBox system by Reg Cryer. So it's worth actually looking at theirs. That gives us a remaining budget in that turnover figure of £14,000. So key partner provider. So this is exactly what Elaine explained there. So works closely with you to give you most informed training needs, understands what the business wishes to achieve over short and long term, helps to mobilize team to attend training, and so on. And they're always a support forum. When we're looking at effective competency assessors, it's to train key staff to become competency assessors and test staff knowledge and skills to determine if they need to attend this level of training. And it goes on, there's so much more. And ensure you have a good documentation for this so you can record it on your LMS. Now, what I'm going to say to you is when we're actually implementing the right strategic plan, we're looking at to have a cost-effective spending, to be compliant, to be competent, promote individual pathways, improve retention, critical, that's going to eat up our money, and plan year-on-year upskilling the team as opposed to doing the same thing on repeat, which is exactly what Elaine explained with the safeguarding model. It doesn't have to be on one specific. If I know I've got one area which is forming a pattern in safeguarding, that's where I want the concentration to be. Now, this big screen here, download for a demo. So if you have your phone out and you want to take a picture of that QR code, what it will do is it will take you to a system that I created, which is called Confident Competence. What I'd like to do is go and have a look at it and book a demo. There's no strings attached. But Confident Competence is basically a system where you've got a library of all these different competencies that you can use, and they're completed through an app on the phone. So once we've upskilled your competency assessors in the workplace, and we run training courses for that, and you've bought the system, you have access to all these competencies, so you never have to Google again or sit there and work out what a competency assessment framework looks like. They're all done by experts, aligned to the regulatory requirements, aligned to your skills for care criteria, aligned to all law and legislation and regulation. So they're perfect for you. It also has the ability for you to write your own in there. Or if you choose to, look at ours and go, I'm going to change that a little bit, and you can customize it, and that will go into a customized library. Once you've done that, you can assign your assessors, and then your assessors go off on the floor with their app and they carry out the competencies. And the idea behind the design of it is that the competency can be completed in the same time it takes to do the task. So this is removing a lot of the burden from you in terms of what competency looks like. But what I'd love to do, if you'd like, is for you to arrange a meeting with one of our team. That can be myself and Elaine, and we can talk to you about how both these will integrate, how both of us will integrate, so we can actually utilize your e-learning, utilize your face-to-face training, utilize your competency assessments, roll all into one, so you have that strategic training plan. But like I said, no strings attached. I'm not here to direct sell to you in relation to confident competence. I believe in the system. I spent a good portion of the last 2 years of my life building it. It's cost a bloody fortune to build, and it's very cost effective, but I do believe this is the missing link to your training plans and strategic thinking, and it will save you money. But more importantly than that, because money's one thing, I know we all need it, I promise you it will help with your retention of staff, because what competency assessment does is it shows that you are supporting the team. It shows that you are watching what they do, they are observing them, and you're advising them. And that's part of nurturing. And we all need nurturing, don't we? And that's what competency assessment does. It's not a case of we're just throwing you on a training course and you know what to do. We're actually going to help you all the way through it. So hopefully I've left that on the screen for long enough for you to actually have a look and download the demo. Elaine, it's of the hour, it's 11 o'clock, bang on. Have you got anything you want to add closing this up? I promise you on the next one we do this, I'm going to let Elaine be the lead so you don't have to listen to my for an hour.
I think we have to change within the care industry. I mean, if you look, we've just recently applied for, had a position available in our company where we have had 310 applications, which means that me and you have had to find time in the daytime, on the weekend, on the toilet, in the night time to look at 310 applications. And what we're hoping is that successful person is going to stay. And because you've already invested all of that time and energy into getting the right person for the position. So I think by making sure that they, especially in that first 3 months, that is absolutely critical, in making sure that staff are feeling supported, able to do their job, feeling safe to do their job, and knowing that there is that pathway for them. I think that is key for what staff are looking for now. But the money that it will save you by having a strategic training plan, instead of it just becoming a tick box exercise, which training should never be, and it's about looking forward thinking instead of just getting on that hamster wheel like we do every year. And so, just kind of last points from me. I am more than happy to sit down with people to do a kind of training needs review on what they've got going on. And again, there's no strings attached to that. We're just hoping that we can, bring you more knowledge with that. And I love that kind of the incompetent competent thing, because if you think that, you might have covered that theoretically, but literally that is kind of a daily thing that you are constantly thinking about. Does this staff member have the skills? Do they have the knowledge? Right? If they don't, what can I do to make sure they've got that? So it's a continual process that again is part of transforming training from just being something that we do because it's a regulatory requirement. It's about an investment in your staff team.
Yeah, so I think as a closing statement to that is don't keep doing it the same way that you've always done it. Change it up. Be disruptive. Be the maverick. Look for different solutions to this, because we could do a whole thing on the psychology of behaviors here and how people learn and different learning systems and styles. And what that will prove to you is that one shoe doesn't fit all. If you don't believe me, just type VARK, VARK, into a computer or into your Google box. Do the VARK assessment. It'll tell you what style learner you are. If you come up as kinesthetic, no way is e-learning actually even hitting the 10% mark for you on that cone of learning. So it's different styles for different people. We're all made differently. Thank you very much. if you've turned up to this live, for giving us an hour of your time. I hope you found it very insightful. Please feel free to reach out to us. My email is paul@cba-training.co.uk. And Elaine's is the same, elaine@cba-training.co.uk. Or you can contact us on 01772 816922, or visit our websites. And for Confident Competence, it's www.confidentcompetence.co.uk. And for CBAT, Elaine, it is
www.cba-training.co.uk.
Okay, lovely. Okay, so yeah, reach out. And if you're watching this on record, we'd love to hear from you. So pop us an email, even if it's to say you enjoyed it, or connect with either of us on LinkedIn. Elaine's there under her name, and I'm there under my name. I'd love to hear what you've got to say. We'll see you next time on the next webinar. So thank you very much. Take care and have a great week, everyone.